There's a couple of relatively inexpensive steps you can take. The first one would be to get a light therapy lamp. This is a lamp that is about $100, depending on which one you get, and it will emit very bright light. It should not have UV light, and you should use it in the morning. These lamps has been shown to help about 80% of people who suffer from SAD actually get rid of it.
Seasonal affective disorder is actually something called a specifier of depression. So it's kind of a subtype of anxiety and depression. And it's more typical. There's actually a fall type and a spring type. And the one that we're probably most familiar with is the one in the fall. And so there's less light and we seem to feel a little blue, or even more so. So it seems to come and go with the seasons is the bottom line. And the difference is that while with most depression, we lose our appetite, we kind of slow down, things like that. With seasonal affective disorder, sometimes you can feel just super tired. It can increase your appetite to where you're eating when you don't really need to. And interestingly, it tends to respond to light therapy. And so for some people, it just means you need to get a little bit more sunshine. Now, there's actually some therapies where you can actually get a prescription for light therapy, and I'm not very familiar with that. But from my reading, I've found that that is actually an option that can be pursued.
Seasonal affective disorder is a notable change in mood that usually has an onset in fall and lasts throughout the winter months. And this corresponds with the decreased daylight that goes with the seasons, as well as how we spend more time inside when it gets colder, thereby further decreasing our exposure to sunlight. So when we have these decreases in exposure to sunlight, a few things happen. It throws off some of our circadian rhythms. It can decrease our melatonin production, which is something the brain produces to help with sleep. And it can trigger a decrease in the amount of serotonin we produce, and serotonin is related to depressed mood, with higher levels of serotonin being related to more positivity and lower levels being related to more depression. Simply planning things you enjoy doing and doing them helps with all types of depression, including seasonal affective disorder.
We don't think that vitamin D deficiency has anything to do with seasonal affective disorder in the vast majority of patients. There may be a few patients who have a true clinical deficiency. The one trial giving people vitamin D for seasonal affective disorder found no therapeutic effect. The only antidepressant that's actually approved by the FDA is Wellbutrin for the prevention of seasonal affective disorder. That indication approved by the government is to start taking Wellbutrin before the winter begins. But other antidepressants do seem to work. Well, there's some very interesting research that cognitive behavioral therapy that gets people up and going in the wintertime can be effective for seasonal affective disorder. And indeed, if you get people up and going, they're going to feel better. They're also going to be exposed to more light. It's a cascade. So we encourage people to do all the things that sustain them.